out some 3.5 years ago to create, based here on our small continuum of care campus, an entity that could pull from all the different sectors in our region and create partnerships around the table to find solutions to all the problems that we face regarding aging. Talk to me for a minute about what it means for Menorah Park itself that Impara is ours and that we're bringing this kind of thing to our staff.
Well, we're very fortunate at Menorah Park because we have a very dedicated and very educated staff in therapies as well as in nursing. And one of the things we stress, or I try to stress as the administrator, is relationship-based care. We talk about patient-centered care, but really we're all in relationships. And I think what Impara has really done for us is really define that relationships are important. Impara was able to bring people to us to help weave and strengthen those relationships.
We are always trying to increase our collaborations, and this is an example where we should be very active together in terms of increasing partnerships and collaborations, because all that does is increase the critical mass of investigators and people that are interested in this particular subject, which is what's required to move it forward.
When we began to do that and think about how we could strengthen those partnerships that we have in the community with the hospitals and the colleges, but to create new ones, that's what we're seeing here today. These new partnerships, these new ways that Menorah Park can work in the community to better the lives of the aged. And that's kind of what we're here for.
We are living longer, we have more technology, and more, shall we say, sense of self-confidence than we've ever had as people and individuals, if you will, that hopefully will predict to not just living longer, but living better.
So we're really concerned about creating the kind of equipment that can be used in telemedicine, that can be used in long-term care facilities, that makes very accurate data very easy to acquire, and then delivers that data where it's needed to manage chronic conditions.
So the idea is, how do you create, if you will, digital Dan skins that you could wear underneath your clothes here on Earth that would reduce the chance of falling, reduce the chance of injury, but also have all the biovitals that you may want monitored, from heart rate, blood pressure, and the like. So the idea is to have it be seamless, to have it be something you want to do, and is not yet one more technology that radiates old man, old woman, or something like that. Because we teamed her up at that point with Carrie Betancourt, who was designing swimsuits for Reebok. We can age cool.
We've talked a lot about all this wonderful technology, but we have to remember who's on the receiving end and how that's going to affect them, and how do we carefully address the patient and family's desires.
Aging is the biggest thing on corporate business agendas and government agendas today. It's the only social demographic factor that I can predict with accuracy. You know how? We're all in the room. We're already here. So business is now saying, wow, the fastest growing part of the population is 50 plus. The highest level of discretionary income is amongst the 50 plus, and we're losing market share everywhere else. So how do I get a piece of that?
I think this is really what we need, because we are going to have to use technology to keep ahead of the game in order to serve the numbers of people that are increasing, that are going to need care, and the sophistication of the care needed, because the conditions they live with, chronic illnesses, are much more complex than we've ever had in our history.